Good morning, everyone, and welcome to our third installment of our series today here at the Richmond Public Library. Thank you so much for having me to present again. So we're hoping that with this talk, we've been doing a lot about sleep, stress, and now we're going to put more towards mood and sleep. And we're going to make some pretty big connections and some pretty big findings for today. So let's get things started. So in this series, we talked first about optimizing our natural stress response. And we found that our stress response is through the adrenals, and it's about regulating those adrenals. And that was what we did last week with calibrating our body's natural cycles, because our adrenals run in through our circadian rhythm. Not only our adrenals go through the circadian rhythm, everything else a lot in our body, not just our sleep, but also our digestion and and our stressors also relate with our circadian system. Now we're going to get into how mood plays a role in that system, as well as with our sleep. And since we talked a lot about how we could optimize our stress response and how we could optimize our sleep, today we're going to also top it off with how we can optimize a bit of our mood to help with that sleep. And then lastly in this series, we're going to talk a bit about melatonin itself. We've been always talking about the importance of sleep, the importance of how we can optimize sleep. Now let's look a bit deeper next week at a very interesting talk about how melatonin acts in the body. And it's not just through regulating sleep, but through many other things too. So again, as a disclaimer, this is not meant to treat, cure, or prevent any disease, illness, or medical condition. If we do talk about any medical conditions, supplementation, etc., that might apply to you, please do bring that up to your physician, general practitioner, nurse practitioner, or naturopathic doctor for that. We're not meant to diagnose you or treat you with any of the following supplements. So a bit about myself. My name is Dr. Romi Fung, and I'm a practicing naturopathic physician in Richmond, British Columbia. I hold a general practice at the Richmond Family Chiropractic with clinical interests in treating Alzheimer's disease and dementia. I completed my naturopathic medical training from the Canadian College of Naturopathic Medicine in Toronto, Ontario. And prior to that, did my pre-medical training in health sciences at Simon Fraser University. And at this point, I am completing my master's in aging and health. I have presented my research in regards to curcumin and the efficacy when it comes to treating and preventing Alzheimer's disease. And I hope to be doing a talk on that sometime soon. As a naturopathic physician, I don't just look at what you have. So for instance, because we're talking about sleep, I have patients that come in with sleep disorders, whether that be, if someone comes in with sleep, I don't just automatically give them anything. I mean, sleep can mean so many things. Is it falling asleep? Is it staying asleep? Are you waking up too often? Are you waking up to go to the bathroom? Or are you waking up not refreshed? And all sorts of other investigations that we have to do. So that tells me a lot more about the physiological part. So what's really happening in the body. And it's through lab testing that we can look further into what your body is expressing, not just symptomatically, but also through hormones and other aspects that we can test through labs. So with today being mood and sleep, there's a lot to mood about and neurotransmitters that we're going to be talking about. And neurotransmitters can be measured through something called organic acids testing. And that typically is a urine test. We can understand that it's not just how much your body has in the case of, say, for instance, hormones. You can measure your testosterone and estrogen and progesterone through blood. But it's also a matter of what your body is utilizing and what your body is kind of using up and also not utilizing in those sense of pathways. And that's where we can investigate, almost kind of like a health detective. And that's what I enjoy doing as a naturopathic physician. So, why don't we get started? So, to get started here, I'm going to start with a question for everyone to answer. Do you think that lack of sleep leads to mood disorders? Or do you feel that it's the mood that affects the sleep? So if you feel that mood imbalances affect sleep, I want you to type A in the chat box. And I'm going to have our coordinator tell me what answers are being called. If you think that lack of sleep affects the mood, type B. And if you don't know, well, type C. I'll give you a couple minutes there. And as they come out, start calling them out. So do you feel that it's the mood that affects sleep, or is it the sleep that affects mood? Or that you don't know? Or maybe that's both. So I think
So,
Mhm.
well, like people are start typing up their answers. I think we will give them like another
Okay,
10 seconds, 50 seconds.
okay, sounds good.
Okay. 2, 3, 2, 3, 4. Okay. I can see we have 4 people said both.
Mhm.
C is
Okay.
their answers in 1, 2, 3, 4, 5.
Mhm.
5 people said B, and one person said A and B.
So I guess that's a C.
So that would be a C.
Okay.
Yeah, I think the
So,
majority of the group agrees C will be the answer.
mhm.
But I
So
think many people like agree B is the answer too. So maybe we have a tie.
Okay, so we have about half the group saying that lack of sleep affects mood. I mean, how many of you have had one bad night's sleep and feel grouchy throughout the rest of the day? I can understand that. And C, yeah, there are chances where mood imbalances can affect sleep, and that lack of sleep can affect mood. We're going to dig deeper into both of these, and we're going to find out what really seemingly is the correct answer. I hope that got you thinking. So first off, we're going to look into what A is. So does mood or mood imbalances affect sleep? So one question to ask is worry and anxiety keeping you up? We have feelings of depression and anxiety that can make it harder for someone to, stay asleep or to sleep deeply or even fall asleep. Many people with anxiety have a difficult time managing negative thoughts and worries. And I can understand it. This is the time that especially is no different. You may find yourself worrying about many aspects of your life. Perhaps you're worried about events that have passed your current situation, or maybe what is ahead in the future. You may be worrying about this time, about your career, relationships, and other responsibilities. And on top of that, you may be even anxious about sleep itself. Have you ever had those nights where you think about, like, oh no, I have X number of hours left to sleep before I have to get up? Has that ever occurred in your mind every single time you look at the clock at every single hour? I know I have. Regardless of the source, of these kind of worrisome thoughts, these feelings of uneasiness can also be quite a stress or a source of stress that prevents you from getting a good night's rest. Worrying at night can make it very difficult to shut off or shut down, turn off your mind, and get the rest that you need. And these thoughts can lead to sleep disturbances, insomnia, making it difficult to fall or stay asleep over prolonged periods of time. And we're finding that there is a relationship between this. So there is a close relationship between what we talked about in the first talk to do with the HPA. So that's the hypothalamus, pituitary, and adrenals. And for those of you that are new to that, that's the stress signaling response and sleep structure. It's about this kind of feeling of anxiety that arouses or puts us alert. So putting us into that fight or flight response, and that leads to sleep-wake alterations. So looking at here, we come back to this graph with the adrenal function. And we know that in the morning, our adrenals should be more active and pumping out the stress hormone, which is cortisol, because we need that cortisol to engage us. Cortisol as well as epinephrine, norepinephrine. So these fire up in the morning to wake us up and to be more alert and motivated in the day. And then it should come down later at night so that we become more relaxed. Stress normally causes a surge in these adrenal hormones, adrenaline and cortisol, that increases alertness. And if this goes up in the evening, it makes it more difficult to relax into sound sleep. So there are people that might be able to fall asleep with the stress going on. Are they staying asleep and soundly during that time? That's another question. Frequent or constant stress can really chronically elevate these hormones, and you put yourself into a hypervigilant state, incompatible with restful sleep. So prolonged elevated cortisol, so prolonged stress hormones that are elevated, can really increase anxiety, can sap your energy, and can really interfere your body's ability to heal. It can also trigger mental health, such as mood swings, anxiety, depression. The key here now is to shift that body from the stress response into the relaxation response. So this can include some of the tips that we talked about, including breathing, meditation, certain yoga postures, healthy lifestyle changes. So cortisol is one thing, as well as adrenaline, that can affect your stress levels and also affect mood. But what other hormone can determine how good you feel? Can anyone think of that? Well, if you're thinking serotonin, you're correct. We know that serotonin is that feel-good hormone, and that could also be counterproductive with adrenaline or with cortisol if cortisol is too high to begin with and chronically too high. In order to think about serotonin, we had to think about other things too. So, has anyone, or do you celebrate Thanksgiving? Has anyone ever had turkey for Thanksgiving and felt sleepy, really sleepy afterwards? Why is that? Well, there's something called tryptophan that is in all proteins, but is also more heavily in turkey. And we know that tryptophan is an amino acid that really contributes to the pathway of mood and sleep. And that's why we're going to think and learn this pathway. I'm going to make it as simple as I can, but I hope that you understand it. First off, we have tryptophan coming from the turkey itself. And once we get the right conditions, we can actually convert tryptophan into something called 5-HTP. And you've probably heard something about 5-HTP. Maybe it's from a supplement. You might have seen it from a supplement store. And you might have been told or recommended by someone that 5-HTP really helps with depression. That or it really helps with sleep. Both are not incorrect. And in our bodies, in the right condition, can convert 5-HTP, so it's something called 5-HT, or we know it as serotonin. And that's our feel-good hormone. And if we're lacking a lot of that serotonin, well, maybe our mood's going to be affected one way or another. And then there's a couple steps after serotonin, but serotonin is then converted into melatonin, which is our sleep hormone. So in order to actually make and allow for these pathways to go, we need to set the body in the right environment. And not just the right environment, but to also provide it with the right resources to create and convert tryptophan to 5-HTP, 5-HTP to serotonin, and serotonin to melatonin. That is why there was actually quite a few number of studies in the 1900s that people could think that they could supplement tryptophan and then they can get melatonin no matter what. But there are actually some evidence that shows that supplementing tryptophan on its own can actually lead to death for one of the things. So it's not really about supplementing these four right here. So these four can be what we call building blocks. But without the right nutrients to help these building blocks get built into something else, then it's just going to stay there and accumulate. It's kind of like going to IKEA and you get, a shelf or a bed frame or something, but all you get are the pieces of wood for you to build the shelf, but it doesn't come with the instructions. Would you know how to build it? Perhaps, but what if it was even more complex? That's where we need the instructions, and that's where we need the right signals that come from the body. And in order to get the right signals, we have to get the right nutrients. So what nutrients am I talking about here? First off, to convert tryptophan to 5-HTP, we need a couple of things. One of them is something called 5-MTHF, or 5-methyl tetrahydrofolate. We know this as something called folic acid. And folic acid is actually synthetic. You want to be getting folate from whole sources. Ooh. Sorry, give me a minute here. Sorry about that. So we need folic acid, but as in the form of folate. And folate really helps with something called methylation, and that's a signaling pathway in something called our epigenetics. We also need calcium and vitamin B3 in order to convert tryptophan to 5-HTP. To convert 5-HTP to serotonin, we need quite a few things that is probably and commonly lacking in our diets. Zinc and magnesium being the big two. And then there's vitamin B5 and vitamin C. And in order to convert serotonin, our feel-good hormone, to melatonin, we need, again, some of the methylation pathways. And I talk about methylation and epigenetics in a different talk, and that could be something that I could also build upon. But just know for the sake of this talk that 5-MTHF as well as SAMe are things that are needed to kind of give like a little flag on your DNA to turn off or on certain signals and certain genes. So we know that serotonin plays an important role in sleep because the body uses it to synthesize melatonin. And we know that melatonin is produced at night and plays a fundamental role in regulating our body's biological clock. But when you're stressed, things happen to this pathway. You can either be not getting enough of the nutrients, or in fact, your body might need these nutrients for other things and thus deplete this pathway and not allow this pathway to then go forward. When you're stressed, you actually use up more magnesium. So more magnesium right here. And we need magnesium to convert from 5-HTP to serotonin. So if we don't get enough serotonin, what's going to happen? Well, our mood's going to plummet and we might not get that restful sleep. Magnesium is actually used for two facets of stress management. It is used for physical tension that leads to stress. That's why I tell a lot of people, especially athletes who are training and constantly going through muscle tension or muscle soreness, that they need magnesium to help relax the muscles. If your muscles are tense, that's almost the same thing as being stressed. Have you ever noticed when you're stressed that your shoulders or your neck start to tense up first and foremost? That's quite likely a symptom of lack of magnesium, and your body's getting the magnesium stores to help relax that. But magnesium also downgrades our physical response to stressful situations. So it's actually very calming. And if we use up all that magnesium due to the times of stress, well, we're not likely creating as much of the serotonin and melatonin that we would have liked. Another way that we can really deplete magnesium stores is by eating sugar. Next time you have something that's really high in sugar, consider thinking that your body's going to think that it's stress and it's going to use up more of its magnesium stores in order to help calm you down. And without being able to produce that serotonin then, with the lack of magnesium, well, we're not producing much of the melatonin either. And you all know that we need melatonin, especially during periods of sleep, to help regulate, optimize, rejuvenate, and restore a lot of our body's processes. Can you imagine trying to sleep with suboptimal melatonin levels? And that's probably what we all are going through, not just with the stressors that are going on in our lifetime, but also the other signals and the environment that's around us. We talked about our body's natural cycles to do with light and also exogenous light. So these are artificial lights that are telling our bodies, it's still daytime. And thus, we don't have the need to create that melatonin. Think of all that's just bombarding us. We talked a bit about anxiety, but with depression, is it the same? Could it be that the lack of proper sunlight could affect mood and melatonin production? Because sometimes we consider or confuse depression with seasonal affective disorder or SAD. This is the time when during the winter months that we're not getting much of the sunlight, and thus our body might be overproducing that melatonin. But could it also be that proper timing of melatonin is very crucial? Because there's correlation studies about those that are depressed are also maybe more active at night. And if you don't have that normal kind of increase in the melatonin, you see here with the normal here, it's a normal increase till about 2 in the morning, and then it goes down. Whereas in a depressed individual, in this study here, that it does go up, but it doesn't really stay up. And there could be many factors when it comes to depression. It could be that the sleep cycle is erratic. And if the sleep cycle is erratic, well, that could also affect the body's way of producing other hormones as well as digestion and so forth that we talked about. But when we also give ourselves that label of anxiety or depression, we tend to also resort to other aspects that are open to us, one of them being medication. And there are medications out there that could potentially deplete our body from melatonin or even inhibit our production of melatonin. So some common medications that could affect our melatonin production in terms of anti-anxiety medications could be Valium or Xanax. And for antidepressants, Prozac could also lower melatonin levels. But there are also a lot of other antidepressants that could really ramp up the melatonin levels, such as fluvoxamine, so Luvox, or norpramine. So these can actually really ramp up melatonin and make you very sleepy. Besides mood medications, there are also other drugs that can deplete melatonin. So these are things such as NSAIDs, so your pain medications such as aspirin and ibuprofen. And we know that pain can also affect mood. So is it really the pain? Is it the medication? Or is it both? Beta blockers. So these are for high blood pressure and abnormal heartbeats, angina. Calcium channel blockers, also for the heart. These also deplete the body of melatonin. And what about caffeine? Caffeine can also really block your production of melatonin too. And that's why we always recommend that you never have your caffeine or coffee after noon, because coffee has a half-life of about 4 to 5 hours. So it takes about 4-5 hours to get rid of half of that in the body. So say if we stopped our coffee intake at 12 at noon, it takes let's say 4 minimum. By the time 4 p.m. hits, you're at 50% of what you have. So you got rid of 50%, you keep 50%. And then 4 hours after, at 8 p.m., you get another half of what you have. So a half of 50. So that's 25. So that means in total you clear 75% and you retain 25%. And then by midnight, you get another half of that, half of 25, which is 12.5. So in essence, by the time you hit midnight, if you stopped coffee at noon, you would have cleared approximately 87.5% of the caffeine intake. Versus if you stopped at 4 p.m., for example, and you only have 2 cycles. So you only cleared 75% and 25% remains in the body, and that could actually still have an effect in your body. But people say, well, you need the coffee for mood. You need it as a kick in the morning for your mood. But it's not going to help your sleep. And it kind of gets into a conundrum, right? You sleep badly, and then you wake up dying for that cup of coffee, and then you feel better. But in essence, you're actually not setting your body right for the next night of sleep. Then you feel crappy again. You're going to get another cup, maybe 2, of coffee. And then that sets the body even worse. And the whole cycle plays over. So think about that. So we talked a bit about how our mood can play a role in the stress and how that can affect our sleep. What about the second option that we talked about? How does sleep affect our mood? Well, the question here is, have you ever had a bad night's sleep and you were just cranky throughout the day? You don't want to talk to anyone. No one wants to talk to you. This has all to do with the fact that sleep is critical to regulate our emotional stressors. it keeps something called the amygdala in our brain. And we're going to see that in just a bit. But note that the amygdala is a collection of cells near the base of the brain. This is the part of the brain that helps with emotions. This is where emotions are given meaning, remembered, and attached to associations and responses to them. So kind of like emotional memories. The amygdala is part of the brain's limbic system. It's how you process very strong emotions like fear and pleasure. So if you're affecting this system here, how do you think your mood is going to play out? Well, if it's going to process strong emotions like fear, it's going to want to turn on your fight or flight response. So this ramps up the stress hormones, primarily adrenaline, but also cortisol. And this could do a lot of things that is, part of the stress response. Opening up your airways so you take in more oxygen, so you're breathing faster, increasing the blood flow to your muscles for maximum strength, so that if it is a flight or a fight, that you can flee if you have to, because it equips the muscles with oxygen. You can increase your blood sugar for more energy. But do we need that chronic increase in blood sugar? It's also dilating your pupils to really enhance your vision. So there's a study done by Dr. Yu in 2007 where they took 26 individuals aged 18 to 30, and they took half of the group to sleep well, and then the unfortunate half to deprive them of 4 hours of sleep. And then they took an MRI scan of the brain afterwards. And they found that those who were deprived from sleep, actually, let me just think here. So they took two groups, one with sleep, one without proper sleep. And then they show images to both groups of something that's very stimulating, like emotionally. And I think it's the same picture, and I was trying to find that picture, but I couldn't. But something that was very negative. And then they took, as they were looking at this very negative image, they took an MRI and they really saw the amygdala stimulated. And those with sleep deprivation had their amygdalas with 60% higher activation than those compared with normal sleep. So there's a lot of activity going on in the amygdala. So what does this mean? And if the amygdala is increased, wouldn't that be better? Actually, it's the opposite. In order to figure out that, we need to look at something called the frontal lobe. So the brain has a frontal lobe, that's the large area in the front of the brain, part of the cerebral cortex. This is where thinking, reasoning, decision-making, and planning happen. So when there's a threat, then the frontal lobes will override the amygdala, because that's where you start thinking about how do I respond to this in the most rational, appropriate way. But when the threat is too strong, the amygdala will act quickly, and that will actually override the frontal lobe. So this is where, when you have that lack of sleep and you make such rash decisions, that's potentially coming from the amygdala. When the human emotional brain is without sleep, these two don't work in tandem. And this is what we call a prefrontal amygdala disconnect. There's a psychologist by the name of Daniel Goleman called this disconnection, or this overreaction to stress, something called an amygdala hijack. So the amygdala hijacks the activity or overrides the activity of the frontal lobe. And thus he wrote a book called Emotional Intelligence. Why does it matter more than IQ? So what happens when the amygdala hijacks the frontal lobe? Well, this is pretty much to stress the fight or flight response. And when you become stressed, well, the body's going to think that you're under threat. It can run away, but also the body really wants you to survive. So it's going to ramp up certain pathways in the body to wanting you to make sure that you get the energy to get out. And one of them is craving sugar. Have you ever had those moments where you either didn't sleep, had an all-nighter, or just didn't sleep well, and you were craving something that was, sugary, junk, etc., at some point in the day? That has to do with your body saying, I need something that is simple and a fast source of energy so that I can run away from this threat. And what happens when we follow that over and over? Well, that leads to sleep deprivation, sugar cravings. Insomnia or poor sleep can lead to poor food choices, so junk food cravings. The sleep deprivation blunts the brain function linked to eating healthier foods. And what happens if we make these poor food choices? Something with high carbs. Well, high carbs is one thing. Are they nutrient dense? Do they have the proper nutrients? Remember, we need certain nutrients, and we just went over this. Remember how we said that we need certain nutrients to create serotonin and melatonin. And did you remember that eating sugar and simple carbs can really deplete the body from magnesium? Are you starting to see the cycle here? I mean, leading to obesity is one thing, and obesity can also be contributing to poor sleep and poor brain health, because obesity and the body fat that obesity contains is very inflammatory. And if your body is inflamed, chances are your brain is inflamed too. And when your brain is inflamed, it will want to protect itself and start really ramping up and utilizing certain nutrients that actually are also needed for the production of serotonin and melatonin. Again, magnesium is one of them. There's also another theory right now that if the brain is inflamed, it wants to protect itself. And how does it protect itself? There's some research. I found it to be quite intriguing, mostly with rats at this time, but because we can't really open up someone's skull and taking a look at it, but there's something called beta amyloid plaque. And beta amyloid plaque is the hallmark, or at least one of the theories of hallmarks when it comes to Alzheimer's disease. And one of the theories behind beta amyloid plaque is that the body or the brain is trying to protect itself from the environment, whether that be from inflammation or from infection. And it's this buildup of beta amyloid plaque that could also potentially slow down the processes and the messages that the brain is trying to send between each cell. And that could lead to, slower message transmission, leading to mood changes such as depression, which are seen in those diagnosed with Alzheimer's, but 10 years or even 20 years, maybe even 30 years prior to actually their symptomatic picture of dementia and Alzheimer's. So it's something to even think about. Is this all really connected? But the idea here is poor sleep is leading to poor food choices because we're ramping up the amygdala and not thinking rationally, leading us to think that we need certain foods for the brain to start functioning at least with the simple energy in order to get your body out of its threat or out of its stress response. And that could lead to reduction of magnesium, for example. And then it just keeps on going. You need magnesium to make serotonin. and you need serotonin to then be converted to melatonin. And if that's not happening, it's a snowball effect. So it's probably best to say that everyone is correct in that first question I asked, because mood imbalances can lead to our choices that could affect our ability and capability of sleep. And if we're not sleeping well, we're not allowing our brain to rejuvenate and restore certain things. And with sleep deprivation, that leads to the imbalance of the amygdala hijack. And if that amygdala hijack is occurring, it's going to go back and wants to start getting more sugar, meaning more magnesium is depleted, leading to more sleep deprivation, or at least not restful sleep. And the cycle goes on. So in that case, what do we have to do? Or what do we do in this case if we can't really find the source? Well, the main thing is we have to start somewhere. Let's find a way to break the cycle. And for those that have attended the previous talks, you've already learned ways about helping with sleep. Now let's find ways to help with the mood for sleep. But first and foremost, these are especially for people who go to sleep anxious, thinking, how many hours am I going to be sleeping? Or I have, 6 hours before I have to wake up for work. Or I have such and such happening and I have to sleep now. Well, rather than saying, I have to go sleep, why not start saying, I get to go sleep? Rather than seeing sleep as an obstacle to work around, why not start seeing it as a special treat for yourself and love the entire process? Real change begins with a simple change in your perception. This is habit. So start maybe thinking sleep as an incredible indulgence, like a dessert, a relaxing massage, maybe a hot date with someone special. You work hard enough in your life as it is. Treat yourself to some incredible sleep because you deserve it. Secondly, is to do with light, and especially natural light. We talked last week about how much lux, so that's the power of the light source, that could hit the eye, the retina of the eye, and then it stimulates melopsin to then inhibit the production of melatonin. This light source then tells us it's daytime and that we should be awake during the day. And we're finding that, natural light, if you were to be directly under sunlight, you can have as many as 30,000 to 100,000 in lux. And you probably remember the pictures in the experiment I did last week, where I even looked at measuring the lux outside directly from the sun, and it was at about 37,000. There is some research done on women in 2008 that showed that it was as little as 3,000 lux that is really needed to start ramping up serotonin. And that's the hormone that makes us feel good. So serotonin synthesis. So if 3,000 is what we need, what about for those that tend to just stay inside? I mean, we're in lockdown right now, but if you can get some form of sunlight outside, and even just standing in the sun, that could be a lot more beneficial, especially in the morning. Because what kind of light are we getting at home? Have you tried using the Lux Reader that we talked about last week? If not, maybe try downloading that. It's free and it's on the phone. And try looking at the different sources of light that's in your house. Compare that to the source of light outside and look at the difference. And for someone that's staying at home, we're probably potentially getting about 300 to barely 1,000 lux just from the light at home. And that light itself is enough to stop the production of melatonin, but maybe not enough to start producing the serotonin. And that's why getting outside can be very, very relaxing and very good for our health and mood. If you can exercise, even better, because exercise is probably one of the more better ways of really, really ramping up our serotonin production. We learned a bit about the pathway of serotonin from tryptophan. So why not we start also getting nutrients to support mood? And first off, most commonly is magnesium that most people are really, really depleted in. You get a lot of magnesium from almonds and dark chocolate. That's probably why women feel a lot better when they eat dark chocolate. But they also come from a lot of dark leafy greens, beetroot, etc. Think about the whole food sources before thinking about supplementation. Zinc was also another big one. And you get a lot of zinc from pumpkin seeds, other seeds, oysters, because zinc is not only used for the production of serotonin, but also used in our immune system and for men in our androgens as well, so creating testosterone. So looking at zinc as a way to support the mood. You get B vitamins from a lot of pretty much anything to do with whole foods. So consider getting a whole variety of foods, whole proteins, and colorful fruits and vegetables. If that's not the case, well, there are supplements that we can consider, and everyone's going to be very different when it comes to supplementation. So please do take this with a grain of salt. But the first one that I like to introduce is something called L-theanine. And L-theanine comes from green tea. But in order to get one dose or one common dose of L-theanine, and that's probably why the Japanese are mellow people. They drink a lot of green tea. But in order to get one normal dose of L-theanine that comes in a supplement, you're probably having to drink at least 10 cups of green tea. That's a lot. Magnesium, probably one of the most common supplements that I would look into. Then there's GABA, and GABA is also very relaxing too. GABA is actually one of those neurotransmitters that we didn't quite touch base on, but it's also very calming, just like magnesium. There are herbs such as passion flower, which is also very calming and really actually helps with the GABA pathway. Then you want to be nurturing your brain more. If you find that the brain is also depleted or the brain is affected, well, making sure that you also get the omega-3 fatty acids, getting more of the EPA, which is the anti-inflammatory component, and also the DHA, which helps build the brain. And lastly, B vitamins. Wouldn't hurt getting a B complex. We need quite a few B vitamins, as you saw with the pathway, to really get that pathway going all the way to the end of melatonin. So in summary, we're all correct. Moods can affect our ability to sleep, and our sleep can determine how our moods are through the day. So it's a never-ending cycle that we need to break out of. And to do that, we have to start somewhere. Support the body's process through nutrients, exercise, light exposure, and sleep. Try using some of the things that we talked about today. And if you have to get back to some of the stuff that we talked about last week, well, I have that talk uploaded on my YouTube, so we're going to talk about that too. But first off, I want to thank you very much for having me. and for listening in on this Monday morning. And actually, I just need to bring up one small thing here, is that bringing back the light. If you're in Vancouver right now, even though the sun's actually kind of coming out right now, uh, I just took a walk at around 8:39 in the morning, and I took my phone out and decided to measure the light that was coming, even though it was a very cloudy morning. And I came up with about 5,000 lux. So even on a very cloudy morning, we're still hitting at least what the study said about the threshold to start building and synthesizing serotonin. So sun, even on a cloudy day, is still very beneficial. So consider doing even a morning walk, or even just at least getting yourself exposed to the morning sun between the hours of ideally 6 and 9 in the morning. So one question for you guys is, what is something you're going to do today to help with your sleep? Why don't we comment in the chat box below? And I would like to see what you're going to come up with, or at least what you've learned in the past couple of weeks. And we are entering the end of April with our last talk next week, and we're hoping to continue this onwards in May and likely June. But this is also driven by your interest, and I would like to know, what kind of topics do you want to hear? Either comment, or I'm going to set up a poll on my Facebook page so that we get an idea as to what these kind of things can occur. And I would like to organize more of these talks for everyone, because I enjoy doing these talks, and I hope you get the same benefits from it. And lastly, if you haven't done so, like my Facebook, searching up Dr. Romi or Dr. Romi Fung, and you're going to get a lot more of the materials as well as the videos. And I might be doing some lives sooner or later, but I do a lot of fun posts, and hopefully we get more of that going on and engaging everyone. Follow me on Instagram, and if you have anything to do with concerns or inquiries, there's always my website, or even just Googling Dr. Romi Fung, and you'll be able to find a way to contact me personally. So I'm going to stop my recording right there, and then I'm going to take a look at this chat box.